Lactose intolerance is a congenital disorder where someone has the inability to digest milk and milk products. In other words, it doesn't sit well with you. It's a condition that affects the digestive system and causes gastrointestinal symptoms. Milk allergies can affect the nervous system in children, influencing their mood. If you are lactose intolerant, you will experience abdominal pain, diarrhea, and passing gas. Those are some of the common symptoms. The least common symptoms are abdominal bloating, abdominal distension, and nausea. Symptoms occur because the unabsorbed lactose passes through the small intestine and into the colon. Lactose is a large sugar molecule that is made up of two smaller sugars, glucose and galactose. They are then absorbed by the cells lining the small intestine. The enzyme that splits the lactose into smaller sugars are called lactase. Lactase is located on the surface of the cells lining the small intestine. When something doesn't sit well, your body would throw it out right away to get it out of your system. People who are lactose intolerant aren't allergic to it. Their body just simply doesn't react well to the food intake. See in picture B, the lactose is passing by the small intestine, but when it gets to the large intestine, that's when bacteria starts to form and the symptoms occur. Lactose intolerance happens when the small intestine does not make enough of the enzyme lactase. Enzymes help the body absorb foods. Not having enough lactase is called lactase deficiency. Symptoms for lactase deficiency are bowel surgery, infections from the small intestines, from viruses or bacteria, and also may cause damage to the cells lining the intestine, which mostly occur in children, and finally celiac disease. In this photo, the red and blue dots represent glucose and galactose. They are passing the large intestine. In its path is the wind, also known as carbon dioxide. The most obvious treatment to lactose intolerance is to refrain from eating lactose. You can take lactose enzyme supplements to prevent symptoms when consuming lactose. Lactase drops may be added to regular milk 24 hours before drinking to reduce lactose levels. Other treatments are capsules and tablets. Not as many people in the US are lactose intolerant than the amount before, meaning more people back then were lactose intolerant, and as the years progressed, the population decreased. Adults and adolescents diagnosed with lactose malabsorption have been shown to tolerate at least 12 grams of lactose, equal to 1 cup of milk or yogurt at one time, particularly if ingested with other foods with little or no discomfort. FYI, malabsorption is the faulty absorption of nutritive material from the intestine. Some evidence to suggest that regularly consuming lactose may increase the amount that can be tolerated by adults and adolescents with lactose malabsorption. In English, that means people who drink a lot of milk/eat yogurt a lot, a whole lot, at a young age can help tolerate it in the adult years. Everybody is probably scared that lactose intolerant is contagious. It's not contagious, and it also can't be prevented, but it can be reduced depending on our diet. Gastric discomfort may be less if you drink milk with meals instead of alone. Eating low lactose cheddar, lactose cheese, eating yogurt with active and live culture can help prevent or reduce symptoms. Well, there you go. You are now experts on lactose intolerant. Thank you for watching.